Atrial fibrillation is a disorder of the heart rhythm that affects many people around this country and around the world. Ordinarily, the heart beats because it has its own timer, or pacemaker, if you will, that determines how fast the heart rate should go. At rest, the heart rate is slow, and with exercise or exertion, the heart rate picks up. Sometimes the normal timing and the normal electrical function of the heart can become disordered. When that happens, someone is said to have an arrhythmia. The most common arrhythmia that affects people in this country and around the world is something called atrial fibrillation. Atrial fibrillation essentially is chaotic electrical disorder of the heart, causing the heartbeat to go too fast oftentimes it's irregular, and the irregularity can sometimes lead to problems with heart function. The signs and symptoms of atrial fibrillation are variable depending on the person. Some people are in atrial fibrillation and aren't even aware of it, whereas other people have significant symptoms when they're in atrial fibrillation. The most common symptom that people feel is something called palpitations, or a fluttering sensation in the chest. People are usually aware of an irregular heartbeat, and they're also aware of their heart beating faster than usual. Besides palpitations, sometimes people feel lightheaded, sometimes they feel short of breath, and oftentimes with exertional activities such as walking up a flight of stairs, they notice these symptoms to be more pronounced. In the most extreme case, sometimes people almost faint from this disorder. Oftentimes it's more of a bothersome symptom than it is a life-threatening or emergent problem. Here at Jefferson, we're very fortunate to offer the full spectrum of therapy for atrial fibrillation. Initially, we assess a person's risk for having a blood clot, or one example would be having a stroke. The reason we do this is that atrial fibrillation causes irregular blood flow through the heart and can put a person at risk for having a stroke. Once we've made the determination of someone's risk, we decide whether or not they need blood thinning agents to reduce their risks back down to normal. In terms of treating the atrial fibrillation itself, for some people all we need to do is offer medicines that slow the heart rate down, and that relieves the symptoms. For other people, we use a variety of antiarrhythmic or anti-atrial fibrillation medications that try to suppress the recurrence of an episode of atrial fibrillation. Every medicine that is available through the FDA is available here at Jefferson. Another therapy that we offer here is something called catheter ablation. What catheter ablation involves is coming to the hospital one morning, often planning to stay overnight, putting catheters through the veins in the upper parts of the leg, using an X-ray machine, moving these catheters into the heart. In a prescribed and very discreet manner, we find the areas of the heart that have the abnormal electrical signals, and we ablate them. Another word for ablation would be cautery, and another synonym would be burn. Once we find these abnormal areas of the heart that are responsible for atrial fibrillation and we ablate them, we can offer the best chance for success for not having a recurrence of atrial fibrillation in the future.